Okay, I think everyone is out of the lobby. Thank you for being patient. Welcome to Cook County Health Department's Schools and Health Update for October 7th. Happy fall. My name is Kelly Jones. I am your host for our meetings. I am a health educator senior with our community engagement and health education unit. It's good for you to spend your Friday with us. Welcome. I just want to go over our objectives as usual to provide updates and support for schools while navigating COVID-19 and other school health issues, answer any frequently asked questions we may have, and provide CCDPH contact information and resources. It is now fall. You see that temperature drop 20 degrees overnight. So we just want to make sure you're enjoying your fall and staying safe. Our agenda for today is I will give you some announcements and some resources. And Keith Wynn, who is a public health educator in our chronic disease prevention and control unit, will talk about our albuterol distribution program. So many people have inquired about that, and we finally are ready to roll that out. And Sheila Giovanni from our communicable disease department will give our communicable disease update along with any questions and answers that you may have. A few announcements. What I want to continue to let everyone know is we are constantly monitoring the amount of information or lack thereof that we have to share with our schools. So if it appears that there is a week that we do not have a lot of information to give out, there hasn't been any mitigation changes or any initiatives we're going to discuss with you all, we will contemplate canceling that meeting because we don't want to waste anyone's time. We're all busy and it's a sacrifice to make it. So just be on the lookout for any meetings that we will cancel because of that reason. I'll make sure I put it in Eventbrite and send out emails as well when we make that decision. All of our webinars are recorded and they're uploaded to our website as well as our YouTube page. Forgive me for not having my camera on. I usually do, but my internet's been a little iffy. And when I turn my camera on, then sometimes you can't hear me. So I want to make sure everyone can hear me okay. We begin promptly at 2:30. Everyone will sit in the lobby until we get started. That's a little departure from when we were on WebEx, and everybody could come right in and just hang tight. Teams allows people to sit in the lobby until we get started. So that is what we're going to do. If you ever hop on and it's a dark screen and it says they'll let the host know you're just in the lobby. I'll let you in at 2:30 when we get started. Please make sure that you have the proper email address for us for use because when I send out information, I get things returned and I want to make sure everyone has the proper information for us. Here is Cook County Health Department's information, email addresses if you want to reach out. And if you notice at the top, we changed the information email address to Healthy Cook. It used to be the COVID-19 email address, which is no longer being monitored. So any questions you may have regarding the webinar, send it to Healthy Cook or send it to myself. EpiPen requests, as usual, send to me at kjones1 at cookcountyhhs.org. Please make sure that these requests come from the medical professional or the person trained to administer the medication. All requests must be typed, and please no links to Google Forms or anything like that. I am unable to open those. Please attach those links. Starting in October, we are required to request the following paperwork. I just put a little screenshot up there of the paperwork. We have to make sure that we have a list of who has been trained and will be the person that will administer the epinephrine shots if necessary. So any new requests will come with this form and we need that filled out and returned as well. One more thing. As I stated before, a lot of people are asking about the albuterol program, and Keith will just go over that right after we do the announcements. And the paperwork is similar to what you are asked for the EpiPen program. The COVID-19 test at home has been paused, but you may still go to the pharmacy and buy them. You can pay for them, or you can have your insurance run them, as well as other resources that I've found that you can request these kits. Information on our Cook County Health clinics that you may go to for any reason, not just your COVID vaccine, but any family planning and any primary care health needs that you have. You can go to any of these clinics. And here's just a few resources that I found. IDPH has a Wellness on Wheels van that can come out for various events and supply different medical needs. So please reach out to that. It's a wonderful resource. The link is here on the slides and it will also be in your handouts. As well as this resource I've found for the Cook County Forest Preserves can pick up your group and take to Forest Preserves for different events that they have. Forest Preserves have a wealth of things on their agenda at the different forest preserves. So don't let lack of transportation stop your group from attending. You can reach out to that information for next Friday. It is Anu is one of our partners, formerly South Suburban Family Shelter. They have rebranded as Anu. They're having a free domestic violence awareness training. So the information is there. Please sign up. I think it's a great opportunity for youth and teachers and parents as well to learn about those signs and symptoms. Just some information on some upcoming vaccination events from partners, as well as all of our events on our calendar of events for Cook County Health Department's website. And tomorrow, our COO, Dr. Lamar Hasbrook, who you met a few weeks ago on our school call, will be speaking at the it's called PT Man, but it stands for Proviso Township Ministerial Health Alliance. He'll be speaking at that, and it's open to the community if anyone is from the community and wants to get on to that meeting. And here's just some more resources, information on rapid antigen testing. I'm going to speed through these because we talk about these every week. Information on monkeypox, and other resources that are available for you if you are interested. You can review these when all the slides are sent out, and they're all on our website if you'd like to go over them at a later date. So I am going to stop sharing, and I'm going to introduce Keith Wynn, who is a health educator with our Prevention Services Unit, to talk to you guys about our Butyrol program. Welcome, Keith. You have the floor. You're muted, Keith.
Hello, everyone. Good afternoon. As Kelly said, my name is Keith Wynn with our Chronic Disease Prevention and Control Unit here at CCDPH. And I've been asked to kind of briefly talk to this committee and kind of give a brief overview of our upcoming asthma emergency medication program. So if you give me 1 second here, I'm going to um, highlight my slides here and see if I can upload my slides for you. Sorry. Here. Okay. So sorry, everybody. Okay. So yes, I said, I'm just going to give a brief overview of our asthma medication program. Um, as you know, the administration of undesignated asthma medication policy, better known as the Public Act 100-0726, allows schools to stock asthma rescue medication and authorizes a school nurse or any other trained school personnel or staff member to administer this medication in the event that a student is under or exhibiting respiratory distress or symptoms of asthma distress. So essentially, as most of you know or may be aware, this act just improves the access that students may have in our schools to life-saving medication. As well, the act permits the school nurse or that trained personnel to administer the medication to any person, like I said, who believes in good faith that they're experiencing sometimes some form of respiratory distress. It allows the trained personnel to administer the medication to a student for self-administration in accordance to that individual's healthcare or action plan or their own individual action plan. And lastly, it gives them the authority to administer the medication to any student who has an individual health care action plan and or action plan as well. And lastly, what the plan does is that it allows the school to administer this medication to students while under supervision at school events, um, before school, after school programs, or any other programs that may be occurring in school. So essentially, any activity that may be occurring um, on the school's campus during the school hours or after school hours. Just like with the EpiPen program, we have created what we call our Cook County Department of Public Health, a standard operational procedure for the Buterol program. And these will, I'm working with Kelly, and so these will be posted on our website. So what this SOP does, it highlights or procedures for schools interested in requesting the medication, interested in also receiving the prescription and the standing orders, procedures for emergency use. Also includes procedures for and protocols for location and storage. And it also provides protocols for schools to follow after the medication has been disseminated. So report forms that have to go to ISB as well to report if you've used if that medication. As Kelly mentioned, we have a wrinkle or a new requirement, and that we just ask that actually moving forward, if schools can make available to us a list of those personnel or authorized agencies who have been trained to administer the medication within their school or school district. So that would be the same, like Kelly said, apply with the EpiPen medication program. Our role, or better yet, our procedures is the same as the EpiPen. It hasn't deviated as the EpiPen process does. So upon receiving your request, and CCDPH will review the request form and the prescription and the standing order to ensure that it is complete. And as Kelly mentioned, I think moving forward, all that information will be typed on the form. So a designated staff person will forward the forms to a licensed physician within our agency. The designated person, as I mentioned, is Kelly Jones. A CCDPH physician will review those forms, and then they will return those forms back to Kelly, and then Kelly will email you the signed prescription and standing orders definitely for your request. And as for that, I just replay Kelly's email at the bottom. It's just some key forms. So hopefully this works. That does not. So we have our Buterol request form, our prescription form, our standing order form, the documentation of training, which is the form that Kelly showed you earlier, is the form that you would use to document training for those who have been trained in your school. And then the Illinois Asthma Response Protocol is just the procedures that you would use in the event that you recognize a student under respiratory distress. So our next steps that we will be undertaking here at CCDPH is that we're planning to, like I said, Kelly mentioned, we'll be launching our program during the month of October. So schools can begin requesting prescription and standing orders from CCDPH. In efforts to get this information out to all the schools, and so that they are aware that CCDPH will be launching this program, is that we'll be meeting and maintaining communication with each of the intermediate service centers to help us promote and share this information with school personnel. Also, during the month of October, as Kelly mentioned, we'll be requesting the documentation forms that are being submitted with your request. We are currently in the process, and will be, this is kind of a long range plan for us internally, is to see how we can better utilize our website for taking or submitting requests, definitely both for the EpiPen and for the asthma or albuterol medication. We realized with the albuterol program that it, some schools or some school districts may have some difficulties acquiring some of the medication financial wise, or may not have the financial resources. So we will be reaching out to the Respiratory Health Association to see if we can identify additional resources or funding sources for schools uh, who may be experiencing some financial shortfalls within their district, or financial challenges, I should say, with trying to have access or gain access to the medication. And as always, with the program, Kelly Jones, she will remain your point of contact. And we have her email address listed right there as well. So thank you, Kelly.
Thank you, Keith. That was
And I
great
can,
information.
mhm.
I'm sorry, go ahead.
And if there's any questions, we can do our best to address any questions that anyone may have.
Okay. If there are any questions for Keith regarding this new program, feel free to put them in the chat. If you're a slow typer, you may unmute yourself and ask Keith any questions you have regarding this program. We're happy to finally be able to bring this to you all. We've gotten a lot of requests over the last couple weeks and months, and wanted to make sure that we got this organized so we can provide this to the community. So I'll give just another minute or so, see if there are any questions. And these slides will be attached to your handouts when I send them out, probably next week. And then we'll probably be able to start taking requests next week or the following week. I think that's the 18th at the latest. So we're rolling everything out next week. Are all the forms available on the website? There's a couple questions, Keith.
We will be placing those on our website, yes.
For now, when you reach out to me, Rebecca, I will email all those forms.
Yes. Mhm.
Next question is the albuterol going to be a one-time use? Will be given disposable spacers?
Um, I don't think that it'll be a one-time use, so that'd be a question that I would have to ask, follow up with our physicians on. So that is a great question. I
Dr.
don't think
Corpix
so,
is on the
but
call if she
oh,
has
is
that
she?
answer.
Is
Yes.
she there? Okay. I didn't know Dr. Corpus was there. Okay.
Or maybe she
Hi,
had to hop.
everyone.
Oh, there she is.
Hey, yeah, it doesn't have to be one-time use. And then for the disposable spacers that we would have to obtain from the pharmacy or through one of the programs that Keith um, was referring to purchase it. So we're just more so from the health department perspective, providing that standing order as the physicians. We're not actually holding supply of the spacers or the albuterol that you would have to get from the pharmacy or through one of the programs that Keith mentioned if there is an issue with the school being able to purchase it.
Thank you, Dr. Corpix. And also
Thank you.
there is a nurse that has a resource and said, check the Respiratory Health Association about spacers and disposable spacers as well. And Rebecca is offering her help to answer any questions about the multi-dose inhaler. Uh-oh.
Hi,
Are you announcing yourself, Rebecca?
this is Rebecca. I'm at a school and that was our bell. Sorry about that.
That was perfect timing. It announced you, so feel free.
Okay, so we've been working on making it easier to get undesignated albuterol and spacers, and there are some resources available, but as the Cook County Department of Public Health said, they are providing the standing order. They're not providing the medication or spacers. What I want to make everyone aware of is that there are disposable spacers that can be purchased through many different supply companies. So like School Health or I think there's a McGaw, or I'm not sure, McCall. So there are some companies that sell supplies to school health offices. and they have available for purchase disposable spacers, but often those spacers need an additional medical authorization form filled out by a physician. So that's something to look into before you're requesting your standing order, so that you'll know if you need an additional form signed by a physician. And then I also wanted to say that we've been working with several Walgreens locations in the North Suburban Cook County area who are willing to fill these prescriptions for schools, but we can provide Cook County with the list of those locations, and they can send that out if that's helpful.
That is very helpful, Rebecca. We're glad that you were able to give us that information. We appreciate your partnership and the resources. Are there any other questions for Keith, Dr. Corpix, or Rebecca while we have them on the call? Rebecca says there are disposable spacers for sale through some school health supply companies. So we'll definitely see if we can get those resources together to have that to send out to people when they are in need. Well, it doesn't look like there are any more questions for Keith. Keith, thank you so much for that information. I will make sure I send those slides out when I send all of the information next week. Thank you, Keith. We appreciate all your hard work. Thanks a lot.
Thank you, Kelly. Thank you, everybody. Thank you so much.
Thank you. Thanks. And now we are ready for our communicable disease update. Sheila, you have the floor. Thanks, Sheila.
Yeah, thank you, Kelly. And thank you, Keith, for such an informative presentation. So as Kelly had mentioned, we are in our fall season. So today our communicable disease updates will focus on our influenza guidance, as well as provide some COVID-19 reminders. We do know currently now during the fall temperatures that influenza definitely coexists with COVID-19. So with that being stated, we want to provide a few guidance in regards to the mode of transmission, some symptoms, period of communicability, the incubation period, and the criteria for exclusions within the schools, and they require reporting for influenza. So we know that influenza is very common, and it impacts more than 3 million U.S. Individuals per year. And we know that it's most commonly spreaded by airborne respiratory droplets, which are cough and sneeze, by touching a contaminated surface, by saliva, which is kissing and sharing drinks, by skin-to-skin contact, which can include handshakes and hugs. We definitely want to note that some of the symptoms are very relatable to common cold, but some of them are a sudden onset of a fever, malaise, body aches, headaches, and chills, and a non-productive cough. The period of communicability, it does definitely vary from 24 hours before the onset of symptoms, which it can peak anywhere between the first 3 days of illness through 7 days. The incubation period, of course, is normally 1 to 4 days. And the thing that we really want to stress here is that we know that, influenza, while it is short term and it can normally be resolved within days or weeks, it is and can be very deadly to high-risk communities, which also includes young children. So as we're looking into our fall season and we're looking in regards to influenza cases within school settings, we wanted to provide you guys with this very basic and general information, but also we wanted to have an opportunity to share the criteria for excluding children and staff from school who may have influenza. And the recommendation is that they're excluded from school until they're fever-free for 24 hours. And that is fever-free for 24 hours without any fever-reducing medication, during that time. And also, we had a few questions in regards to when influenza should be reported. And we want to just let everyone know that it is not required to report the cases to our local health department. But we do welcome if there are cases.
Sheila, I think we lost your sound.
Hi, I'm sorry. Can you hear me now? Hello?
I
Hello?
could hear you just
I
fine
can
the
hear
whole
Sheila.
time,
Hi,
Sheila.
can you hear
See
me? Okay.
if I can take
Okay.
over control, then maybe Michelle can finish this slide while we get Sheila's sound together. Hold on a second.
Hi, Kelly. Everyone is saying that they can hear me. Hello?
We
Can you
may
guys
have
hear
lost
me?
Sheila. Oh, you guys can hear Sheila talking?
Yeah, we could.
Then maybe
We
it's
all
just
heard
me that
her.
lost sound. Okay,
Yeah,
continue. I'm
yeah,
sorry.
Michelle.
Okay, you had me panicking there for a moment, Callie. So I think the majority of the people that can hear me. So I'm going to go ahead and continue. So I was speaking upon the required reporting for schools. Again, while it's not required to report influenza cases to our local health department, we do ask that if there are cases of staff or students who may have been hospitalized or who unfortunately passed away or died from influenza, that you notify us. And if you're seeing like groups of cases, clusters or so within a specific setting, we would like to know. So if you can let us know of those within a school setting, we definitely appreciate that. So let's talk about the preventive and control measures and what we can do. So we know that it's spread through respiratory droplets. We know by touching contaminated surfaces. So with that being said, I just want everyone to be mindful that, we're still looking at preventive measures within regards to hand washing. Make sure that we are continually having students and staff wash their hands regularly and that they're knowing to wash their hands at least 20 seconds with soap and water. As we look at respiratory hygiene and coughing etiquette, we actually want to make sure that we are making sure that people are coughing and sneezing within their elbow and that they're not touching many surfaces with their hands or sneezing and coughing within their hands in which they can transmit the viruses to other surfaces. And we do know that the influenza virus can remain on surfaces, hard surfaces, for many days. So we're asking that we're continuing to have schools to be very mindful of cleaning surfaces on a daily basis. And also, of course, the influenza vaccine is available now, and uh, anyone age 6 months and older can get the vaccine. So we highly recommend that everyone gets the annual vaccination for influenza. So shifting gears to our COVID-19 reminders, I wanted to highlight our COVID-19 surveillance data, and this is available on our Cook County School Health webpage. I provided the Shiny app website address available for you, and our Cook County suburban level, community level is currently still at low. Again, it is really a great practice to go in on a daily basis and get the accurate data for suburban Cook County. Again, you may note that this may be slightly different from what you may see on our CDC side in regards to our Illinois Department of Public Health side in regards to the data because they also capture Chicago, Evanston, Skokie, and Stickney Township and Oak Park, whereas our data that is available for you on our respective website only covers our jurisdiction and in our suburban Cook County level. So please feel free to visit this site on a daily basis. Again, it's available for you Monday through Friday. And just a few reminders. I think reminders are really good. I think reminders are definitely necessary and good because it keeps things top of mind. And I know that this has been discussed before, but especially with the change of season and now that we're in fall, perhaps schools are not able to utilize some of the same ways to improve air ventilation within school settings that they were able to do in the summer. Now that we're in a chillier season, perhaps it is a good opportunity to make sure that the school administration and the custodial staff is aware of our American Rescue Plan that is available, where there is funds that can be used for allowable expenses for schools to be able to purchase things that can help keep and improve their air ventilation in school during our fall and winter months ahead. So I provided the link there so that you can utilize at your convenience and look and see the services that are available for your schools that can utilize to keep the ventilation within your school and air quality safe. Again, I wanted to remind everyone that we have a new but not so new COVID-19 reporting process, and that information is available on our school health website, and the link is provided there for you as well. And of course, I would be remiss if I did not provide a link to our COVID-19 vaccination and booster page. And this is really ideal because not only does it provide you with basic information in regards to the boosters and vaccines and, just general information, it allows you to find a facility within your respective area in which you can go and get your appointment scheduled for your booster and your vaccines. So I definitely wanted to make sure that you had access to that link readily available for you. And during our last school call, I touched upon very briefly in regards to our Executive Order 2021-22, and that order has been rescinded per our governor in regards to school personnel having to task bi-weekly to stay in school if they're not fully vaccinated. So I wanted to also provide you guys with that reminder. And finally, I wanted to make sure that you guys had access to our on-site mobile vaccination clinic. Here you can request our on-site mobile clinic to come to your respective schools. It is the application process, and the link is provided below for you. If you go to question number 13 on this application, you will see that you have the chance to select what preventive measures that you want to have the on-site mobile vaccination clinic available for. So if you're looking for COVID-19 or if you're looking for the influenza shot, you can pick which one that you would like the services to be rendered to your school. Keep in mind that there is some discretionary in regards to the flu influenza shot, but it is available for you right here on this site, and the link is provided below for your use. So thank you very much for your time and attendance today. We definitely appreciate you taking time to join us. Thank you. Callie?
Thanks, Sheila. This is the time. I see there's been some great questions, and Rebecca has been fantastic with supplying resources in the chat regarding ordering for those albuterol things that you need. So if there are any other questions that have not been answered in any of the presentations, this is your time that you can ask these questions. And like Sheila said, we appreciate you guys taking the time out of your busy Fridays. I know that some schools are closed today for, believe it was parent teacher conferences. I know my son's district was closed today. So we appreciate you taking the time, whether you're on the clock or off the clock. We really appreciate it. So we'll give a few more minutes for any questions or to copy any of those links that were put in the chat because there's really good information. And like I said, we will, I'll make sure I send everything out next week. And our Butyl Owl program, which should be up and running in the next week to 10 days. And you can start sending in your requests, and we will make sure we get those done as soon as possible. And also, as an announcement, I didn't want to announce it ahead of time. I didn't want to confuse people about when we are meeting, but our November 4th meeting will be canceled CCDPH has a staff in service that we are attending. So I'll make sure I send out information and emails and put that into Eventbrite to make sure I cancel it. But just if you're a person who likes to put things in their planner, just so you know, our November 4th meeting will be canceled. We won't be here. We're at a staff meeting. So if there are no other questions, and I don't believe I see anything else in the chat, we are going to adjourn, and you guys go out and enjoy a little of this sunlight and this cool weather. This is my favorite kind of weather, so I'm happy. Some people might be cold, but I'm very happy with this kind of weather. That 90 degrees is for the birds. So I'm going to adjourn. Michelle has a reminder. Yes, as a reminder, Monday is Columbus Day. We are closed. So unless it's an emergency, you will not be able to reach any Cook County Health Department staff on Monday. And all the slides will probably get to you guys on Wednesday as we are off. So if there are no other questions or announcements, you guys have a great weekend and we appreciate your partnership and your support. We will see you next time. Thank you. Thanks, Michelle and Tarek and Sheila and Dr. Corpix and Rebecca. Have a great afternoon.
Likewise, thank you.
Thanks.